Hello, my name's Deborah Montague and I'm the founder and chair of ALK Positive UK. It's a small charity that was set up in the UK 2 years ago for the support and advocacy of patients with ALK positive lung cancer. I was very kindly asked today to speak on the unmet needs in the care pathway for lung cancer patients. And whilst my expertise lies in the field of ALK positive and my experience, I believe that many of the needs that we've identified will be synonymous with lung cancer patients right across the spectrum and across different countries. So first of all, the important bit, the declaration of interests. I have received several fees across the last 2 years, but actually they've been paid directly into the charity's accounts and not myself. So let's have a look. Unmet needs in the care pathway. The first unmet needs we've identified are in actually earlier diagnosis. Now, I know that I'm talking primarily to a hospital audience, but I think it's very important to understand the length of time from first signs of symptoms to being diagnosed in the primary care setting, because that obviously then demonstrates a need for timely and quick review within the secondary care setting as soon as patients are referred into the hospital setting. As you can see from the first graph, the time between the first visit to GPs and a diagnosis of lung cancer can vary anywhere between 2 weeks and up to 18 months. And obviously for patients who've waited a considerable length of time, their lung cancer has potentially been progressing during that time. The other interesting thing that we've identified is around what patients have been prescribed in the time before their diagnosis of lung cancer. And as you can see, this can vary from COPD treatments through to painkillers for those representing with shoulder pain, through to antibiotics. And very often for the patients who are prescribed antibiotics, it's not just one course, it's 2 or even 3. So this further delays an actual lung cancer diagnosis, and obviously is adding to the stress levels of patients whilst they know there's something wrong, but they don't have a diagnosis. I would imagine this is similar for many patients, irrespective of whether they have a genetic mutation or not, across the lung cancer community. The other unmet need that we've identified, and I apologise, what I should have said at the beginning is that the data that I'm presenting here is from a survey that we carried out of all our members 12 months ago. And so within the charity, we have a support group of 370 ALK patients now, and we sent these questions out to our members, and this is where this data comes from. But as I say, I do believe that the disparity between different patients actually would span across all lung cancers. One of the things we looked at was around scans, and the first one we looked at was around MRI scans and whether patients are having an MRI scan at the beginning of diagnosis or very shortly afterwards. And you can see that it's pretty evenly split between yes and no here. And then the other thing that we looked at was around treatment for bone mets, and there seems to be quite a lot of inconsistency here as to whether the patients have been treated with biphosphonates or not, and we see that still occurring today. The one area that we didn't look at was around anticoagulant treatment, and what we are hearing anecdotally is of many patients who develop a blood clot and then are put on anticoagulants, but are then actually taken off them after a period of time. Now, I don't need to tell this audience that obviously if you've got lung cancer, you are more prone to blood clots, and so it would seem reasonable, and also once you've had one blood clot, you are therefore at higher risk of developing further blood clots. So it would seem reasonable that there should be a consistent approach across all lung cancer patients, and possibly all cancer patients, that once you've had one blood clot, does that mean you should stay on anticoagulant treatment for the course, and stay on there for the rest of your life? It's a question that's being raised, but it certainly shows that there's an unmet need in terms of consistency of approach. When we went back and had a look at some of the other scans as well, we looked at CT scans, and what was really reassuring and great news is that 99% of patients are receiving regular CT scans. However, it does mean that there's 1% that aren't. And if you look at the actual numbers of patients that are being scanned, 1% is not an insignificant number of individuals who therefore aren't receiving regular CT scans. What does vary is the frequency. And I think, again, there's an unmet need in terms of a clear, agreed frequency of scanning. And also we were able within our population with our survey to have a look at the difference between NHS and private treatment within the UK. And again, we can see that these differences are very similar across NHS and private. When we look at the MRI scan at the beginning, if you look at the chart on the right hand side, it shows that, you know, roughly the same numbers are given an MRI at the beginning of diagnosis, or whether they're NHS or private. So again, you know, from that perspective, there is an inconsistency whether you be NHS or private, which is in one way is reassuring from the patient's point of view, that there's not a difference in care from if you are private in the UK, but nevertheless it does show that there is a need for a consistency for all patients. The other thing we looked at was the frequency of CT scan, MRI scans. You can see here the breakdown between private and NHS, and there is a consistent difference of opinion and a consistency of approach, whether you be being treated in either setting. Another unmet need that we identified is for clinicians to signpost patients to support groups, and it's an area that we feel that not enough is understood about the benefits of patients belonging to support groups. When we surveyed our members, only 15% have been referred to us from a medical professional at the time of the survey, which is incredibly low. The other patients had found us by Googling and looking through the internet. Maybe it's not understood completely as to what the benefits are, and you can clearly see this is the feedback that we've received from our members. But I think there's nothing like a patient being able to talk to another patient and to get reassurance. You know, patients very often have an off day, irrespective of how long they've been diagnosed or how recently, and very often want a duvet day. And we have many patients saying, "Oh, I just lost hope today, I feel," you know. And so there's nothing like another patient saying, "Okay, that's fine, why don't you have a duvet day, why don't you, you know, get on the settee with a big tub of ice cream, the biggest bar of chocolate you can find, and watch Netflix all day, but tomorrow you've got to put your good big girl or big boy pants on, and you've got to get out there and acknowledge all the things that you can be grateful for and to look forward to." I think it's only another patient that can get away with telling someone to do that, whereas other, you know, well-meaning individuals, whether they be healthcare professionals or patient or family members, are likely to get feedback like, "Well, you just don't understand what I'm going through," and that's true, they don't, but other patients do. The other area that certainly where support groups have come into their own is during the pandemic, where the message quite clearly, rightfully by the government was, you know, to not waste the NHS time. That has been translated in many patients' minds is the NHS is too busy and I mustn't contact them and bother them. And we've had patients that have reported, you know, maybe a swelling or some new side effect. And what we've been able to do is to reassure them that the NHS is very much available for them and open for business. And we've encouraged them to get in touch with their oncology teams. And several people have come back and have reported that they've had, you know, blood clots identified, which is great because they've been able to treat them, and that hasn't had any impact on their overall survival. So there are some very, very good reasons for patients to be referred to support groups, and ones that are referenced as well. There's a lot of, I know there's a lot of other groups on the internet, but if you can find the support groups that have been ratified and are endorsed by other healthcare professionals, then I think it's important that we see more medical professionals referring patients over to support groups. The other unmet need, it's quite small. I'm really pleased to report, because the vast majority of patients are being looked after exceptionally well by their healthcare professional and their oncology team, which is great to know. But there are still a few occurrences where we hear reports of patients coming back with quite heart-rending stories of feeling that they've been treated like a machine, as part of a machine, and not a real human being. We've had a number of people report that their doctor doesn't even look at them when they're talking about their results. And I think it's important for doctors to try and understand the standing in the patient's shoes. When a patient gets a diagnosis of cancer, their life as they know it ends, you know, at the point that word, the C word, is talked about, and everything else now is then the unknown and is very scary, and a lot of people take a lot of time to come to terms with such a diagnosis before they can get on with thinking there's something to look forward to, and I've still got a life, and and I can manage this. So I think it's really important for doctors to really try and think about the person that's sat in front of them. There will be a lot of consequences to being given a diagnosis of lung cancer. Many will hear the words lung cancer and believe that's it, it's a death sentence immediately. And I think it's very important how that is phrased and talked about by healthcare professionals. We still hear stories of people being told they've got 6 months to 12 months to live, which is really upsetting for those patients. I think healthcare professionals also need to understand the background to patients as well, in terms of their family makeup. A lot of patients will have young families and will be desperately worried about them. And that's another reason to encourage patients to join support groups, because that's where they can share stories of how they've been able to tell their family members, and the types of language that they've used. So again, really, as I want to stress, the majority of our patients are delighted with the way that they're managed by the healthcare professional, but I just wanted to put it in there because not everybody can say that, and it would be great if they could. The last thing I want to say is there should be stronger links between smaller hospitals and the centres of excellence, so that everyone can share the expertise of the experts. We don't expect everyone to be an expert, but if you've got access to one, that's going to improve the overall survival of patients as well. And finally, I'd just like to say thank you very much indeed for giving me this opportunity. I hope you found some of the information useful and informative. Thank you.